This is Dr. David Berman of Berman Cosmetic Surgery and Skincare. I'd like to take this opportunity today to speak with you about SmartLipo. It's one of my favorite procedures, and it's been one I've been doing for quite a number of years. And I'd like to explain why I like it so much and why I've done probably over 1,800 cases so far of SmartLipo. So what is SmartLipo and how does it compare to regular liposuction? So regular liposuction, basically everybody in the world knows about. It's been around for about 40 years. What generally happens is the patient would go to sleep, the surgeon would put fluid infiltrate into the area and then suck out that fluid, and when they remove the fluid, a significant amount of fat would come out. It works. It's been around for 40 years. It's a very, very good procedure. However, what's different about SmartLipo? So SmartLipo is very different. I don't do it under general anesthesia. It's not done in the operating room, and it's not done in a surgery center or a hospital. Excuse me. So how do I do it? I give the person oral sedation, makes them nice and relaxed, somebody drives them, but they're able to walk. And then once they're in the office and I've marked them, I make very, very tiny incisions, probably 2 to 3 millimeters, usually 1 or 2 tiny incisions per area that's being treated. After I've numbed up that area, I insert a cannula or a catheter underneath the skin, and that's connected to an IV bag, and when I step on the pedal, it will fill up the area with lots of local anesthetic. Nobody's immune to it. Everybody gets numb. You'll still feel touch, just like if I push on your running shoe, but you will not feel pain. You'll just feel touch. You're wearing goggles, so you don't have to worry about being able to watch it. I play music, we'll usually talk. Sometimes the patients fall asleep. After I've numbed them, then I put a very tiny laser fiber, about the size of an inside of a big pen. So it's very tiny. It's actually about 1 millimeter. And I move that fiber optic laser fiber back and forth through the subcutaneous tissue. Every time I step on the pedal, 2 wavelengths of laser beams comes out, and the laser beams are very specific wavelength. One targets the fat, so it melts the fat, and the other one will tighten the skin through heating the skin, which again, you will not feel. After I've done that for some period of time, I will then liposuction out the fluid, which is mostly fat, but obviously has some of the infiltrate that I put in. I will then put a dissolving suture to close the incision and a Steri-Strip, and the patient will bring Spanx or spandex. They'll go home. The rest of the day, they'll probably be pretty sleepy, but they can get up and, make something to eat, etc. Next morning, they can shower, they can drive to work, they can take the kids to school, basically be normal with everything, except I don't want them to work out hard for 5 days. They can go for a nice long hike or a walk, but no hard exercising. What can they expect post-op? They'll be a little bit sore. I give most patients some narcotics. Most patients need either none or 1 or 2 pills. It's very unusual for somebody to need more than that. And one of the reasons it's not uncomfortable is the skin will actually feel somewhat numb after the procedure. So if you touch your abdomen or touch your arms or touch your thigh where I've treated it, it'll feel somewhat dull. And it typically takes around 3 to 5 days for the feeling to come back totally. There can be bruising. A lot of patients don't bruise, but some, may bruise. And if you get a bruise, it will last 2 or 3 weeks. Everybody gets some swelling. When do you see a difference? It really varies. Some people will see a difference immediately. People that are more fit and have smaller areas will have some degree of swelling. That might be hard to see the improvement for a couple of weeks. The important thing to know is people will continue to improve for 6 months. So this isn't like an all or none effect immediately, like a breast augmentation or a breast reduction or a tummy tuck where you'll see a huge change right away. It's a much more gradual process. And as I explained, patients improve for 3 reasons. They improve because I'm reducing the fat. And I'm always careful to explain you're going to get an improvement. I cannot make you perfect, and nobody else can. 2, you will get some degree of skin tightening. That's going to vary from person to person and area to area. 3rd, and this is very important, and this is why you keep improving for 6 months. If you think of the fat as being a block of cheese, I make it look like Swiss cheese with all these little laser tracks going through the fat. It takes your body about 2 months to fully heal those tracks for the collagen to cross-link, and then between months 2 and 6, that scar tissue will gradually tighten and improve. So it's very, very important for people to realize they will get better and better for 6 months. I always tell patients there's no magic. If you eat a healthier diet, lose some of your body fat, exercise, you're going to enhance the result. And obviously the converse is true as well. Typically, I'll see you at 2 weeks and then at 3 months, 6 months. But there's social visits. You're going to get better regardless of whether you see me. So if you come in from out of town, it's not necessary to come back. I have patients come from out of town and they'll just send me a picture. Antibiotics, I don't give anybody any antibiotics. Literally in about 1,800 cases, I've had one very minor infection once, and that's it. I've never had a problem with bleeding or seromas. There's no drains placed. There's just a little Steri-Strip that comes off after about 5 to 7 days. So if you have interest or questions, please email me at the office, or I'd love to see you for a personal consultation.